All right, it's Friday, everybody. We made it through another week here safely together. We want to get to coronavirus inside the Arizona numbers. Let us know where you're watching from on this Friday. We've got a lot of new information to get to today. A lot of things changed this week, as it does every week, really, here as we track these coronavirus numbers, but a lot to talk about. I'm Katie Raml, alongside me, Garrett Archer, our data guru. Garrett, let's get right into this. Obviously, there was a higher number reported today, just like we saw yesterday, but there's a lot to that number.
Yes, we are nearly coming up on about basically double what we did last week right now. I mean, our case counts are getting pretty high, but obviously there's a lot more to that. So that's why we're going to go into this, very important today. So we'll just start at the summary page, and this is what we're talking about. We have another 4-digit new case day, 1,281, with 42 deaths reported. And this is off of about 8,000 tests, which obviously if you do the quick math on that, it's pretty high. It's about a 16% positive. Now, here's some of the explanations on this. The AZDHS contacted me this morning, let me know, kind of walked me through what these numbers were. A lot of these numbers are the sort of final batch of antigen tests that are being added to the system. This is from ASU, U of A, and any other places that we're doing antigen tests. This is based off of the new classification that was just put out on the 9/16 that basically made it so that antigen tests were presumptive positive. Just by nature of taking an antigen test, you are then considered a probable. And you can really see that right here. We don't track this number very much, but it's hard to read. But the probables for the number has gone up pretty dramatically. It's always been in the low 1% range, and today it's at 2%, which I know doesn't sound like a large jump, but this is cumulative. We're talking about 212,000 cases, and it went up a whole percentage point in one day. So it added a bunch of presumptive positives today from the antigen tests. And we do have sort of an idea of where they came from, and we'll go over that. But as far as what the numbers look like today, not just the summary numbers, but our percent positives, the actual percent positives, still about 5%. All of our metrics still look pretty good, going in the right direction. It's just that we're sort of going through this antigen test bump right now that is going to cause us to have some, if Brant's on the phone or on already, I'm going to use the word noise, have a little noise coming up. But hopefully, as time goes on, it'll get a little better as far as more normalized. When I say better, I mean we won't see these massive jumps.
Okay, so Garrett, do you even know what? First of all, an antigen test is for everybody. That is testing for pieces of protein, whereas the PCR test that we've traditionally been reporting to, that's testing for the actual virus itself. And the real draw here to the antigen test is how fast they can do the test.
And this is why it's considered a presumptive positive. I know a lot of people hear that word presumptive positive and they freak out, but this is an excellent test at doing a rapid check for the proteins that are caused by COVID-19. But that's, again, it's looking for proteins, not the actual virus itself. You can only get the traces of the virus from the molecular test, the PCR test, where you're literally enhancing it until you find traces of the virus. And this is not looking for traces, it's looking for proteins. So the good thing about that is that it still can find, these proteins that are from the virus. It's not possible to get a false positive with a antigen test, but it is possible to get a false negative. And it's a little more likely to get a false negative with this test than it is from the PCR test. Harder to do that with that one. So this one, that's why it's a rapid test. So you can take it a bunch of times. That's the thing. Now,
right. It's one of the keys to getting back to football, to getting back to business, to getting back to sports, to whatever those things are, so that we can say, okay, bam, you're cleared. Bam, you're cleared. Go, go, go. And we can get back to real life, so to speak.
Exactly. Yeah, you can get, that's exactly right. And still, just so everyone knows, the numbers that are coming through are still being deduplicated in the system if a positive test is found. Okay. So when you see these numbers and we see these case numbers, and it's antigen test versus PCR test, if someone took a PCR test and then took an antigen test later, because say they're an athlete and like you said, they want to get back to sports, they will still have been deduped in the system. So just so everyone knows, that's still going to happen.
Yeah. So if you went and took an antigen test and you wanted to go get a PCR test because you were positive with that antigen test, just for clarity, you would still be counted the one time. So you can test and test and test. It's counted as you based on your name, your date of birth, all that information. So when we're seeing the 1,281 reported today, do we have a breakout of how many of those are antigen tests and how many of those are PCR?
No,
or they just saying we've got 1,281 that are diagnostic?
Yeah, well, no, we know what the probables are, and the probables are antigen tests.
Okay.
So right now in the system, and it's sort of brand new, we know that we've added about 2,000 to 3,000 over the last couple of days antigen tests that are presumed positive. So that we know about. But as far as time goes on, as this breaks out, it'll be more difficult. It's going to get harder and harder every day to figure out what's antigen and what's not antigen, because it's not broken out specifically in the system.
Okay. So when we see that, the one thing that the other number that we watch in that summary page is, of course, the new deaths reported in. We had 42 added to the count today, which puts us at 5,451. 35 of those came from Maricopa County.
They did, but a lot of these are, just to understand, this was definitely a death certificate matching day. Very aggressively. I think it was about 72% of the deaths that are being reported today. These 42 deaths are coming from August or before. So this is not recent deaths. If you look at the curve if you look at our mortality curve, it hasn't changed directions yet. It's just that this happens. It's actually been happening more frequently, but it's been happening with less and less sort of higher numbers. So it's actually a little more rare now to get these higher numbers when they're doing these certificate matching. Yeah,
Jose Candace is writing, I got tested again at work today. So some people are getting tested in the workplace, it sounds like. Hopefully you got your answer back pretty quick, Jose. I know when I got tested, it was like a 24-hour wait. And then when I did an antibody test, months later, it was about a 36-hour wait. Oh, and Jose writes now to wait for the results. So hopefully it's quick, that you get a pretty quick answer. I know the turnaround's happening a lot faster. You're not really seeing much of a lag, are you, Garrett?
No.
Reporting numbers at all.
Well, so yesterday had a pretty big lag, but it was a lag from a batch drop. Right. They basically dumped cases and tests from 42 days. Yesterday. Today was very different. Although it was this antigen test, it was much more recent. Essentially, every test that came in today came in from the last couple, like from the last 7 days. 9,000 tests from the last 7 days. The cases were still a little more spread out, but again, only about 32% of the cases came from August, which is better than yesterday. Yesterday was a lot of cases came from August. So they're catching up, essentially. A lot of deduplications and a lot of catching up, because these batch tests, when they do these batch dumps, they have to go back through and check for sort of because positives are almost always put in there. It's the negatives that aren't. But when the batch dump happens, some of those positives that were already recorded are also in the batch dump. So they sometimes get re-recorded, and then it takes them a couple days to deduplicate. So it'll sort itself out over the course of a couple days here.
So Deborah's asking. Deborah writes, "Is the antigen test still a nasal swab?" It can be. It can be either a nasal or a throat swab that is taken by a healthcare provider, and then it's tested. So sometimes the test can be run right there while you wait, and sometimes the test needs to be sent over to a lab for testing. So it's similar in that to the PCR test.
I see Erica's asking about the antigen test, if it's checking for antibody or current. It is a diagnostic check. It does check for a current infection, not an antibody.
Yep. Some people who are saying that this is scaring people. We hope it's not scaring people. This is why we talk about this, to dispel any fears, to make you the most informed people out there as far as these numbers go, as far as making choices for yourself and your family, whether you're heading back to work or you're sending them to school, so that you know the best numbers, the truest, latest number, down to your neighborhood, down to your zip code, down to your school district. We're here to help you through that. So that's why, being transparent shouldn't be scary. It should be looked at as being informed. Exactly, Christina. That's exactly why we do this. So if you have questions, post them in the comments, and we'll be happy to answer all of them for you as they come in. Let's see. Swari writes, "So how can we get an accurate read on the state of the data if there is such a lag in entering it into the database?"
Well, if you give me a second, I will give you an accurate read of the state of the data, because we can look at it via the epi curve, which will give us sort of an accurate picture of where these cases and tests are coming. So I'm rendering this now. As soon as it comes up, I will show you. 1 second. This one takes a little bit of time. A lot of graphics.
That's okay. While it's rendering, Jan asks, oh, it just went by. Jan,
oh,
Jan,
no, not this one. Sorry.
Does this mean we need to hunker down even more than we have been? Jan, the one thing I can say is we don't want to make any decisions for your life, but we do want to help you find the best information. So you know your health and you know your lifestyle the best, but anything we can do here to help provide more specific numbers for your life, we're here to do that for you. So you have to make your own choice on how much you stay in, how much you go out, but and again, based on your own health, and you can talk to your doctor for a little bit more on that. But we can get you some really solid numbers here in Arizona.
So this is the case epi curve. This is the actual date of the test collection. So this includes all of these new numbers where they're being put. And you can see the light blue. It's a little hard to see, but you can see speckles of light blue all the way across the curve here, which means that these tests, these positive tests occurred. You know, there's one right here that happened in late July. So there are a lot that, and then you can see right down here a little smattering of blue. That's deduplications going on. But this basically shows you the actual state of infections. And you can see, if you just, even if you disregard the moving average, you can see, yes, there has been an increase for this most recent week, but it's not a significant sizable increase at this moment. Here's what it looked like today. So you can see this is that 37% of the tests from September 5th prior. That's where all those cases came from, when these 669 cases plus these 215 were the ones that are the most recent. Going to the tests, you can see it's a similar thing here. In fact, almost all the tests, like I said, were added in the last couple days. There's almost no movement anywhere else. And the lag for the test is like 3 days here. And this is what you can see right here. There's almost nothing anywhere else. It's all from the last couple of weeks, from 9/13 on. And then the deaths. We'll just do the deaths really quick as well. And this one tells a completely different story. You can tell here, you can see deaths being added all the way as far back as May. So you've got some in May, you've got some in June, you've got some in July at our peak right here. So that's why we had such a high number, but this was done with certificate surveillance.
I'm seeing so many good questions coming in right now. You guys are on it today. Melissa, Vicky, Rich, I'm going to get to all your questions in just 1 second. So hang close here. There's so many good questions coming in today. We'll get to those. Garrett, anything else on this page before I move to some of those questions?
Let me look really quick. I don't think so on this particular page. The only thing I'll say about this page, since I have it up, is I know people ask about the recovery numbers and the active cases. Right. And our active estimate has increased because of these antigen tests. It's gone to about 10,900 to about 18,200. That's sort of the estimate of case age. Cases that are either under 14 days, 10,900, or under 28 days, which is 18,200. That's sort of our best.
Did your floor change on that, or did your ceiling change on that? It seemed like we thought it was like 10,000 to 16, and now it's about.
Yeah, well, both have changed. I was that 10,900 used to be about 9.9. It was 9,900 the last couple days, about 3 days ago. So it's now gone up about 1,000. Yeah.
All right. Julie's asking, where can we find this info? Julie, let me know specifically what you're looking for, and I'll make sure you have that. I think it's the AZDHS site that you see.
So a lot of my charts are a little more enhanced, but you can find this data on the AZDHS dashboard. I'll show you where to find it really quick, just for everyone. I'm on the summary page right now. When you look over here in these sort of buttons, you can see this one called Cases by Day. You can click on this, and it will come down, and it will show basically the same epi curve I just showed you, and you can even look at it by different counties. So, like, for example, this is Yavapai infections. Here's Yuma, which, you can see huge spike in Yuma. You can basically go through all of these and see what's going on in each county.
Okay, so let's get to some of these questions. You guys have good questions today. Let's see. Vicky is asking about. Vicky writes, where in Arizona do they have the most cases? And I am
so glad you asked.
The zip codes What is going on in a few of these zip codes? And in particular, that's catching our eye, 85009.
This one popped in the last couple days. They must have just dumped antigen tests from the county jail system, because 85009, if you're not familiar with Maricopa County, that is the Lower Buckeye Jail Complex, and there are multiple correctional facilities within a couple square miles of each other in 85009. There's Lower Buckeye Jail. I mean, I can't even name them all right now. I actually have it up. Let me just, I have it ready to go just to talk about it. So
what do you think happened here? They just went through and tested everybody in the prison and then dumped it all. Okay.
Yes. So you can see right here that I just literally put in Google and I just jail 85009. And these are all the essentially prison complexes for the most part. There's a couple government offices in here, but that are at the 85009 zip code. This zip code has just recently become the top zip code in Arizona, just yesterday, in fact. Go ahead.
We're looking at 4,798 cases there.
Yeah,
and that's the entire span of the pandemic, not recent.
Yes, but it is recent. I'm going to go to my zip codes and show you what I'm talking about here. And I'm just going to pull something up. This is the zip code chart for 85009. I'll put it in as sharing it right now, and you can see what this thing looks like. If the lower third can be pulled away, it'll be easier to see the dates. Thank you, producers. So this is the height of the pandemic right here at about 621. This area is where at least the spread in the community was the highest, and obviously you can see that this is what happened in the last couple days here has increased this number sort of beyond exponentially in 85009. It says 85281. I do apologize. That is my fault, but this is in fact 85009. So please ignore this right here. I didn't change the title of this. It's a working graph for my own purposes, so it's not published anywhere, but this is in fact 85009.
I mean, so you think this will just drop back down? This is like a one-time thing. They just tested everybody at the prison to kind of get a handle on what's going on, or?
I think so. We've seen that in 85281. In fact, I'll pull up the actual 85281 right now as a comparison, because that also had a pretty large jump, and you can see what happens here. Let's see right here. I'll pull this one up. This is, like I said, this one is in fact 85281. It is, and so it's titled properly. And you can see this one had a major jump. This is ASU, and then all of a sudden they withdrew a ton of cases. So this could still happen in 85009, where we'll see this really high jump and then a lot of withdrawals. But we just don't know yet. It's going to take a couple days to work it out. But that's where we are right now at this very moment.
Like Kai just posted here, this is a concern for everybody. And as Kai posted, people still visit others in jail, which means it can still be spread. And let's not forget about the officers and the security who are working in there. And they can also potentially spread the virus. Kai,
it's why, and it's exactly why because people ask me all the time on Twitter, well, why are they having these congregate settings as part of the per capita gating requirements? And it's like, and obviously that makes it very difficult for some places like Buckeye, like Florence, where they have large prison facilities that can impact their numbers. But in reality, as she just said, there's movement in these areas. The guards work there. Usually there's a lot that work there, and they have to monitor them. So they have to be part of the per capita calculation.
Yeah. So it's exactly, some people are asking why does that affect the rest of the public? Because if you're sending your child to school and they're going to school with somebody whose parents work at the jail and they're around everybody, that's how this affects an entire community. This is why it becomes a community issue and an issue for everyone. So those jail numbers are so super important. Yeah,
especially at the jail, because jails by definition have a lot more transit between them than like a prison, where it's a little more, you have more people in longer term sentences.
Yeah. Okay, so many good questions I want to get to. Rich or Richie, I'm not sure how to pronounce that, is asking about colleges. Why are colleges not reporting to the numbers? And I think, there it was asked a little bit back. they are required to report their positive numbers. So that's why you're seeing that bump over the last couple of days when ASU was adding their numbers. So here's what happened, I think, with this. And Garrett, we've talked about this before, because ASU early on said, we're not going to report our numbers.
Yeah.
What they were meaning is to the public. They weren't going to start a public portal to show everybody what was going on. They, of course, always were going to report their numbers to the state. But it was important to finish that whole sentence about who they were reporting to, and that's where that confusion came in. So we want to
there is now the one thing that's true about the antigen tests, and I have talked to some epidemiologists about this and some doctors, is that like a clinic, a doctor's office that does an antigen test is not required to report right now.
Okay.
So that is true. Now, as far as a positive test, I would be almost positive. I mean, I don't know if there's a requirement, but I would presume that if you're a doctor's office and you're going to take an antigen test and someone goes positive, you'd probably send that over to the AZDHS. But as far as your negatives, they're not required to report their negatives. And I can imagine like a very busy doctor's office, if they're doing antigen tests all the time, they're not going to sit there and have someone like, adding all this stuff together to send the negatives over to the AZDHS. So my understanding is there is no requirement for reporting of like individual doctors' offices with these antigen tests, because it's much easier to do these than it is the PCRs, which really requires laboratory, like a lot more laboratory work. And so they're always going through LabCorp, always going through Sonora Quest, all these other places.
Yeah. Okay, Melissa asked a question a little bit back, and I'm going to have to scroll back to find her comment. But basically, the gist of Melissa's comment was there was some confusion about something we've talked about before. She's looking at the zip code that she lives in, and then she's looking at the school district. And here's her question from the producers putting it up here. This is great. So she writes, a school in 85009 is in red. However, the school district map for the district says yellow. How do we determine which map to follow regarding making school choices? So you should really, Melissa, be looking at all 4 places to find numbers. So your county, which is not in red, it should now be in yellow at this point. Look at your zip code just as you are. Look at your city, and then look at your school district. So we'll drill down for you on that if we can. I'm assuming that's in Maricopa County, 85009. Yes.
Oh yeah, of course.
So let's pull that up for her and kind of explore what she's seeing there. And this is not totally rare. This is similar to what I was experiencing in my kid's school district. The zip code we were in is in yellow. It goes that way. The school district we're in goes that way, and that's in red. So we were seeing 2 different numbers. So it's important when you're making choices for your family to look at all of these numbers. So we can look at yours in particular and show a good example of how
this is 85009. It is currently in yellow, although I would, just because of today's numbers, there's a very good chance that 85009 will flip to red on Thursday. So just so everyone knows, because that case per 100 is going to shoot up unless they withdraw a ton of cases from 85009. So it's going to likely move to red. But I can see there's a little bit of that going on here. If you look at the elementary school districts, you can see there is some crossover with Riverside Elementary having a higher % positivity and being in the red, and then some crossover obviously with 85009 not being in the red, but still 85043 being in the red. And that is going to happen. You're going to have situations in which zip code overlays with school districts is going to have some funny, numbers going on. I mean, look at this right here. Is a great example is Tempe. We already know ASU, huge numbers out of ASU, a little better this week than it was last week, 322 rather than 730. However, let's pull up the unified, or not the unified, the high school. And you can see all of Tempe Union is considered substantial, even though if you look at the zip codes outside ASU, it's all yellow. So this does happen right now.
Yeah. It's important to look at all of those. So hopefully Melissa asked the question a little bit ago. Hopefully she's still with us, because it's just important to look at all those places. Not just one. That's the best advice we can give. Can't tell you what choice you should make best for your family, but I would suggest looking at all four maps so you have a real good idea of how your neighborhood looks.
I do see some confusion in the Facebook chat. Antigens do not mean you already have it. Antigen is not an antibody. It's a different test. The antigen means that it's looking for proteins, not for serology. It's not looking for antibodies. So just so everyone knows, they're two completely different tests.
Yeah, they sound the same. So there's so many words that we're all having to
exactly. Yes.
All the things. Oh, Melissa is still here. Oh, good. Melissa, you're welcome. She's writing thank you in the chat. I hope that helps.
I'm going through zip codes because I see them coming up. So I'm like, yeah, I'll go through zip codes for a second while you're saying hi to Melissa. So
Melissa, I hope that helps. And Garrett's going through some of those numbers that you all are typing in. Remember, if you weren't with us yesterday, that's when this new zip code map and this new school district map would be updated, because it's updated late on Thursday. The lucky news for everybody that joined us yesterday, it was already updated at the time we hopped on. So if you were with us yesterday, if we got to your zip code yesterday, as Garrett's typing some of those up for you, that it has not changed since then. Garrett, thank you for going through some of these.
Oh, sure.
Deborah's asking, where can I find these charts? Deborah, I think you mean the map. If that is the case, you can find it. It's the school's dashboard. It is only through Maricopa County. So Deborah, if you're outside of that, you won't be able to see this great map that we get from Maricopa County. They just put the address up on the screen. There it is, maricopa.gov/school dashboard. And that should take you there.
85004 is one of my, I don't want to say my favorites. That's like a bad word, really. But this is a downtown zip code. Definitely ASU students here, because you can see cases per 100 was at 290. It's even higher than it was 2 weeks ago. It's the only zip code left in downtown that's considered red. To me, that has to be a combination of ASU, and I think 4th Avenue Jail is also in this zip code. So both of those together is going to cause this to jump up. So just
as you punch up some of the other zip codes, I'm just going to answer a few more questions. Oh, Deborah, you're welcome. I see your thank you there. Ashley's asking, how do I get this map? So the same way we just talked about with Deborah, just that school, maricopa.gov/schools dashboard. And remember, it is just for Maricopa County. The other question that I just saw, why would anyone want to get an antigen test opposed to the other two? Kayla, sorry, Kayla. Kayla writes, so Kayla, the big advantage of that antigen test is it's fast. That would be the biggest thing. Like if you are playing in a sport, if your kid is going to play in a game or a tournament, or you're a college athlete, or you're going back to school, it's the perk of that one is it's just fast. So that's the big thing. If you got a positive there, you could go double up with a PCR test, a diagnostic PCR test, just to make.
That's exactly why it's considered presumptive positive. So if you take an antigen test and you're considered positive, then I would imagine that your healthcare provider would then basically ask you to go and take a PCR test. In most cases. But that antigen test is that rapid testing that's allowing for places to have opening schemes and allowing people in, because it's a rapid test rather than these PCR tests that can take days because they have to be processed at a lab.
We had some questions about the numbers at U of A, ASU, and let's see, ASU's would have been updated last night. As we're looking at that zip code map, I want to update you on one other thing that has happened today. The CDC has sort of reversed course on their guidelines. They were heavily criticized, and all of you know that not easy for me to talk on a Friday. Those of you who have been here with us each and every day, we talked about when these CDC guidelines came out and how important it is to really go local, to go to your local, your state-based health department or county-based health department and find out a little bit more information on how things look in your area. Remember, the CDC is talking to the entire country. Things could be different in your particular area. So at that point, when the CDC came out with guidelines, they were heavily criticized. And as we told you, go local, learn a little bit more. And our local leaders did reflect that if you've been around someone who has COVID, you need to go get tested. And last month when the CDC came out, they said, you do not necessarily need a test. Okay, so now to today, they've reversed course and they are saying it is critical, if you have been in close contact with someone with COVID, to go get tested. Exactly what we've said in Arizona all along and what came out on the director's blog. That's why it's so important to go look to your local health leaders, because we can have a different situation happening here than they are across the country. And especially so because it's all, they've reversed course. Sorry, I have a helicopter flying overhead. They've reversed course entirely for the CDC, but that just coming out today. So I wanted to update you. You were on the right track if you've been here with us, and And we've heard all along from the health department here to go get tested. Test if you have symptoms, test if you've been in close contact and don't have symptoms to make sure that you are safe. That's it for me, Garrett. That's all I have on that today. Seriously, though, they are continuing to update everything as it comes along. Hey, Margaret's asking about testing kids under 6. You would need to call their pediatrician for that, because that testing at ASU, that saliva-based testing, I think it's for 7 or 8 years old. I know that my daughter was old enough to do it. She did not, but she was old enough. And she's 8. My oldest one is 8, but my middle one is 6. And she was not old enough. So call the pediatrician and they'll be able to let you know. My little guy's got to get a COVID test next week. So we're having to go actually through the hospital to do that. So just call the pediatrician. They'll be able to advise you specifically. But if they're over 7, man, that saliva test is so easy. So easy. All right, Garrett, back to the other question. Where were we?
Well, we can move on to something else. I do see Anthony Paul is asking about antigen tests and PCR tests, and I will say that no, they aren't. When someone takes a positive, now this is a positive test. So if someone tests positive with a PCR test and an antigen test, they would be deduped into one test.
Okay.
Tests equal, not necessarily equal people, and he is correct about that. We don't actually know how much deduplication happens on the tests themselves. I do believe some does happen, but I'm not exact. I mean, that might be just the positive cases that are getting their negatives also deduplicated or something. It's difficult to tell. It really is.
The other thing that we wanted to talk about today is that under 20 age group, and things are changing rapidly for that group. Margaret took us into that segue of the kids, and let's stay there with that, because that under 20 group is a number that we're seeing climbing faster than the other age groups that we have here in Arizona.
Yes, I do have. Now, you're going to have to, I was trying to get this done in time, but it's still in chicken scratch mode.
That's okay.
Let me show you the chart I have on this for the age groups. So, and it's going to be a little difficult to, oh, wait, wrong one. Sorry. Ignore that. Let me try that one more time. Here we go. Okay. So this is sort of the chart, again, in chicken scratch mode from September 1st of the growth, the per capita growth of every age group. And you can see these two right here. This is under 20 as well as 20 to 44. So you can see huge increases in their per capita growth from just this last couple of days. Otherwise, everything's been tracking together. So the last several tests that we've had with these congregate setting tests, the jails, the universities, this is really impacting the 20 to 44 and the under 20 age groups. Really, most of all, the under 20 age group, they're growing by leaps and bounds right now. 1.5% today, as opposed to the others, which were like a 0.5% point.
Okay, so it's something still to watch. I mean, so are we at like 13% of our?
Yeah, let me look at that to see where we are, if that has changed, and then I'll bring it up right now so that we can just look at it together. This is the demographic dashboard on AZDHS, and we can see we're at 13% right now. It's about 28,000, almost 29. It's about 28,000 cases, 28,279. That's where we are with that less than 20 years old. We don't get a lot of data below that. Yavapai County is one of the counties that does give us data below under 20, but they almost all stick with this under 20.
So here's the thing on that. We get the under 20 from the Arizona Department of Health, and as we've addressed that's the best we can get from the state.
Yeah.
When we go on Sonora Quest's website, they give us a few more breakouts on the age demographics. Is that solely just offered from them, and not something that's then replicated in these charts here from the Department of Health? Maybe because every provider doesn't know that or doesn't designate that. And how much more information can we get from that Sonora Quest site? Because Sonora Quest is such a big provider of testing here in Arizona, that going to that site might be able to provide us a little more insight into how things look. Obviously, not a complete picture, but if they're doing a majority of the tests, it might provide a glimmer of what that looks like for them.
So this is interesting. This is one of the things that initially AZDHS early on, very early on,
Mhm.
they did have an under 5 category. And that really makes it sound like because Sonora Quest also gives us this under 5 category. And then they have 5 to 19. AZDHS decided to roll these all up right here. This is the Sonora Quest website. So we're looking at only diagnostic tests done by Sonora Quest. You can see of the, what is it? I mean, of the 106,000 detected patients, about 905, about almost 2,000, when you put them all together, have been under 5. That's a very favorable percentage for that group of people. So.
And does it tell the number of overall tests on that particular site? I'm trying to remember. I haven't been there for
They do. Hold on. I was just getting I mean, I know it's really small, but I just wanted to get it. Hold on. Sorry. Let's see. Where was I? The number of positives that have been fully ordered is right here, 705,000. This run here. So that's, what is that together? That is 824,000 tests all have gone through Sonora Quest.
I mean, that's a huge number when you consider what we have with 1.5 million tests here in Arizona. So it gives us a pretty good look at how things could be.
Yes, absolutely. So yeah, I just want that percentage of under 5 positive tests. It's about 1.8% out of all the tests, positive tests that Sonora Quest has done. About 1.8 have been under 5.
Okay, so a worthwhile site if you guys want to check it out. You'll find a little more information over there. That is a spot that's, I believe it's open to everybody, isn't it, Garrett? You don't have to be a Sonora Quest.
Yeah, no, this is just a Sonora Quest latest COVID-19 news. They do have one. I'm sending it over to the producer. They do have something that they do send out to just the media, but it's not much different. It just gives us a tiny bit more information on one data point. And honestly, I don't even know if they do it anymore. They used to do it during the pandemic peak, and I'm not sure they're doing it right now.
Yeah. Okay. Well, just another place to check out and get a broad picture of how things look. Okay. We got a question that I want to address. Frank is asking 212,000 cases, 5,400 deaths, only 10,000 recovered, question mark. I think what he's confusing is 10,000, Frank, active, 10,000 to 18,000 active. So
yeah, active. Yes.
That would be, so you would subtract 212 minus 5,000, take about 18,000 out in the high end. 10 to 18,000 are the ones that are still active. And then that whole other number that you get, that's what's recovered. Of course, as he's asking there, does that mean the remainder are still suffering from lingering issues? It means that of the range we can tell you from 10 to 18,000 active cases right now, there are going to be some long haulers, and that's the term for the people who you're speaking of, who are still fighting this and still trying to get better. But that's the best number we can give you at this point. Did this affect the R naught number today? That's one site I did not have a chance to go to. I don't know if you got a chance.
I told you the R naught's going to be super noisy, and
you don't even want to look at it.
Yep. I know Brant hopefully is still watching, and I did use his favorite word again.
Right.
And the RT, I've got it spread up. It's at 0.94 today. I'm actually, like, it's interesting. I had a conversation with someone who's a much better statistician than I, and he did tell me that they do in this try to work through some of the proportionalities when it comes to the tests and the cases. So we may not have the increases that I was thinking. It should still go up, but maybe not like all the way over to where Delaware is. But so today, without the information, full information from today itself, because this is always 24 hours behind, it's at a 0.94. So we'll see what happens tomorrow and the next day. And see if this goes up again.
Yeah, we're coming up on a weekend here, so Saturday reporting will likely still be reflective of maybe the same thing that we saw today. A little slower on Sunday and Monday. We'll try to peek at it and then chat with you guys about it on Monday once we get back from the weekend. So when we're looking at this percent positive, and you know what, I missed one of the questions I said I would get to. Kathy, a few minutes ago, maybe even 30 minutes ago at this point, we've continued this conversation. Kathy had asked, what should we be looking at here? Do you think we should be checking on case numbers, she writes? Should we be looking at percent positive? So Garrett, the question is twofold. how do we see the percent positive now when we have these crazy numbers being reported, and then if we take those crazy numbers out and just try to get maybe a more actual real time percent positive there, and then this, I can let you answer that, and then the second part to follow up on Kathy's question for a little while ago. What do you think are maybe the points people should be looking at now? Would it be the case numbers, because those are getting so crazy it's hard to read? So if I'm a novice at this and I'm looking at things, geez, I always used to look at the percent positive. Now the case numbers catches my eye. What is kind of your go-to place for you right now?
I would say if I'm just casually looking to see how things are happening in Arizona, really, and my tip would be to stick with the hospitalization numbers for just casual observation, because they're probably the most reliable and some of the best indicators of what's actually going on. So I'll share this really quick. We've talked about these several times. Here's our inpatient numbers. We had talked how this one was starting to go up. It's gone a little bit farther. It's gone down again today. So, it's still establishing sort of a level pattern. But this is also sort of a lagging indicator. This one right here, the COVID-19 emergency room department, is, to my knowledge, one of the best sort of leading indicators we're going to have of what's happening out there. So as you can see, this one has been somewhat level as of late, but it also matches what we've seen in our cases. Our cases have also been somewhat level. If this starts to go up, and I'm not talking about these sort of one-offs where it goes from 861 or 811 to 915 in one day, which seems scary to go up by 100 in one day, but then it's going to go back down. We want to see this sort of over a period of 5-6 days. If we don't want to see it, but if it does start to go up in a period of 5 to 6 days, that's sort of a thing that if I'm casually looking at that's probably the biggest concern. Case counts can be funky because of the antigen tests and the backfilling and everything else that goes on with them trying to record everything for for historical purposes and everything else they're doing. So I would definitely say, if you're really, just watch this first, and then at the second, if you really need to know what the cases are, always go to the epi curve and not the reported numbers, because the epi curve is way more of reality than what the reported numbers are. And you can see, even with those 1,200 numbers, 1,700 yesterday, we don't have any, we have no day over the last couple of weeks that's an actual date where it's been over 1,000. So yeah. We get these 1,700, but then they're parsed out through this entire curve.
Okay, so let's show everybody where to find this. You go to the AZDHS site, because obviously we won't be here with you this weekend. And if you're super curious and you want to just really keep track of that, go to the AZDHS site and then scroll down to...
Here, I'll start it from the very beginning. So if you're at AZDHS, you go to Data Dashboard right here, which brings you right here. And then the two places I clicked on was... in fact, it's essentially almost at the corners here. So hospital COVID-19 specific metrics for all of the COVID-19 hospitalizations, as well as the COVID-19 cases by day. This is the next one. This will just give you the epi curve of what's really going on right now. Yeah.
Okay, so if you guys are super curious over the weekend, that's the place to check. Of course, I always say go to Garrett's Twitter account, because even on his days off, he's keeping us updated. You do a brief summary that kind of what's really helpful is the up and down arrows and the side to side arrows that tell us the change in those metrics. And those are on his Twitter account, at Garrett_Archer is where you can find him. My Twitter account is at Katie Raml, just one word. If Facebook is your preferred place, I know so many of you are watching us on Facebook right now. That is, you can reach me on Facebook at facebook.com/news from Katie. Thank you to all the thank yous coming in. You're so welcome. We'll be back with you on Monday, of course, around the same time. Garrett, one last word. What are the things you're kind of going to be watching over the weekend? I do want to note we passed 30 million cases worldwide today, 6.7 million of those here in the United States. There's a possibility we could sadly hit that 200,000 mark of lives lost here in the United States. So that's going to be something sadly to note over the weekend. But what will you be watching?
We'll be watching what we just went over, the emergency room numbers, as well as some of the changes in those antigen-heavy zip codes, 85009, 85281, to see what's happening in those specific zip codes. And then, of course, on Sunday, the biggest thing that happens on the weekends is that the COVID-like illness syndromic surveillance graph on the AZDHS will update. Right. And that gives us a great idea of what happened from week to week. And so we've seen all these case increases, but really, unless the CLI has moved up, then they're, like I said, they're just cases in the past.
Yeah. Okay, we're going to leave it at that. Hey, Margaret, I see your note. Katie, can you DM me the hospital info for COVID test for kids? I absolutely can. Can you hang till Monday? Because I probably won't talk to them again till that point. So just DM me and I'll get you back. I'll get you the information I hear from my provider. And oh, you're so welcome. That's it for us this weekend. We're going to send it out. Be safe out there, everybody. And we'd love to have you back on Monday. See you then.